Okay, so now that we have our back table set up, we're going to set up our Mayo stand for a minor procedure. Minor procedure is usually a breast biopsy, a hernia, something like that. Specifically, I want you guys to set up for a breast biopsy. So for a breast biopsy, the first thing we're going to need, and I'm going to put these in the order that we're going to use them. We're going to need an incision. So first thing is a knife handle. Next, what we're going to need is we're going to need to dissect down. We incise, we hemostase, which would be our bovie, because we're going to hemostase. Dissect is going to be our scissors. So we're going to find our Metzenbaum scissors. Those are going to go next. Incise, hemostase, dissect, retract. So we're going to get some retractors. Breast biopsy, we don't know how big the lump is until the patient comes in. So we're going to grab our Army Navy retractors and our Sin retractors. Sin retractors, we're going to make sure this pointy end is always pointed away from us. So we want to make sure that we keep all the sharp things pointed away from us and our doctors. All right, next we're going to do 2 hemostats. Hemostats are here just in case we find a bleeder that we have to deal with. I'm going to put those this way. We also know that when we are using our scissors, we need to grab the tissue. So we are going to get a forceps. This is a DeBakey forceps. It's nice and gentle so it doesn't damage the tissue that we are going to grab. I want a DeBakey forceps, and then at the end of the procedure, we're going to suture, and we want an Adson's with teeth. My 2 forceps go together like that. Actually, I like this better like this. I like my forceps and then my scissors. My 2 hemostats. We're going to grab 2 Alice's because we are going to grab the tumor in a breast biopsy, and we want something that has a little bit of friction and traction to it, but is not going to damage the tissue. So 2 Alice's. All instruments also should be clicked on the first ratchet. We don't want to click them all the way down. We just want them on the first ratchet so they don't flop, but they're easy to open. All right, once we get our tumor out, then we're going to do our irrigation, which we have here. That can stay just right there. Then we're going to hemostase again, which is our bovie. Then we're going to suture. So I need my needle driver. And in this set, I only have a giant one. So we're going to use this giant needle holder. He goes here. And we need something to cut that suture with. Straight Mayos or suture scissors, whichever one you want to call them, go here. Okay, now we know we're going to need some sponges. This is something that I do. You can just take your sponges and set them up top up here. That is perfectly acceptable. For a minor procedure, as a general rule, it will just be you and your doctor. I find it easier to count my sponges at the end of the procedure if my circulator can see them all. So I lay them out like this. If you're going to lay your sponges out like this to help you count, make sure that you can see these blue lines. Those blue lines are actually what we count. That way we know they're Raytec and not dressing gauze. So we lay those out like that. I put my bovie on top of there. I want to have a needle book up on my Mayo stand for a minor procedure like this because my hands are going to be busy. Once again, I want to make sure I have a place to put my sharps. So I'm going to put my needle book up here. I'm going to put my medication, usually a local of some kind to numb the area. So I would draw it up. If I have a 20 cc syringe, I'm going to drop all 20. We never just drop a little bit. We drop whatever is in there. 20 cc's. I'm going to put my hypodermic on there. Don't squeeze your hypodermics down to where you can't get them off. Just put it on there so it's snug. And then that way it's easy to get on and off. Now, very important with your hypodermics. When you go to hand this to the doctor, you hand it, it's going to come back to you. I never want to see you do this. Those needles can puncture the top of this, and they have, and techs have been stabbed with them. We're going to do what's called a one-handed close. So your syringe comes back to you. Usually they'll kind of toss it up on your Mayo stand, or they will hand it back to you. You're going to take it, put your cap on, and then grab the very bottom and pull it down snug. Don't grab the top even when it's already on there to push it through, because that needle can still come through the sides. So make sure you're grabbing the very bottom underneath the hub of the needle. So as long as you're below the colored part of the needle, you're good. And my local is going to go right before my incision, because we probably want to numb up our patient before we actually make an incision. Now, last but not least, I'm going to go over here to my drapes, and I'm going to take my suction tubing. It's going to come up here. I'm going to take my light handles. They're going to come up here. And now that way, when we're ready to start the procedure, I have everything I need to get started, and we don't have to wait on anything.